that rollout switched, for us, it raised alarms.
First up at 5 o'clock, while our state gets praised for having one of the fastest vaccine rollouts in the nation, a new civil rights complaint says the age-based plan is hurting people of color.
The new rollout has some minorities feeling like they're being discriminated against. Channel 3 Eyewitness News reporter Mike Savino is live right now in East Hartford, breaking down the concerns for us tonight. Mike.
Mark and Aaron, this complaint says that the CDC guidelines, the ones that we were previously following, better represented people of color, especially with its emphasis on people with pre-existing conditions and also frontline workers. And now this complaint is hoping to get Connecticut back on that track.
Historically, there's always been this disparity in outcomes for people of color.
For weeks, Connecticut has faced criticism about the low vaccination rates among Black and brown residents. Now, the state is facing a civil rights complaint. 3 groups, including the Connecticut Legal Services, filed the complaint Monday with the U.S. Department of Health and Human Services.
There was probably going to be an issue, but it's compounded by this age rollout.
The complaint focuses on the state's change to an age-based rollout. The CDC recommends frontline workers and people with certain underlying conditions get priority. The new complaint says those guidelines would help people of color, who have been hit hardest by COVID-19 and have difficulties accessing the vaccine.
I think it's false.
Governor Ned Lamont dismissed the argument Monday, saying the age-based rollout is faster for everyone. He also pointed out that the state is working with providers to vaccinate underserved groups.
We have to do a special outreach to make sure that they get vaccinated.
But this is at least the second civil rights complaint in response to the rollout change. Disability Rights Connecticut filed a complaint last month saying Lamont made the change even though it was well established that people with disabilities are disproportionately negatively impacted by COVID-19 and are more likely to contract the virus and experience severe, often life-threatening and prolonged symptoms.
The equitable way isn't always the easy way.
Those behind Monday's complaint want Connecticut to once again allow people with underlying conditions and frontline workers to again move to the front of the line.
Greater Hartford Legal Aid and the New Haven Legal Aid Association are the other groups that are behind this complaint. Meanwhile, Lamont said Monday that Connecticut remains on track with its rollout, the next group becoming eligible on March 22nd. Live from East Hartford, Mike Savino, Channel 3 Eyewitness News.
Mike, thank you very much. Now